Do we need faster horses to transform our health system? A quote that's been attributed to Henry Ford goes something like this: if I would have asked the customer what they wanted, they would have said they wanted faster horses. Today, politicians, health administrators, physicians like myself, patients, we often want the same, but just a little bit better. Put yourself back in the 1890s, 1880s, maybe in a small town somewhere, and imagine that you are a professional horse trainer and horse breeder. You've spent your entire life acquiring the knowledge and skills to ride horses incredibly well, to manage a business and make a lot of money. Your social prestige is based on your ability to ride horses. And then you start hearing about these horseless carriages. So maybe a steam powered, we would call them automobiles or cars. Back then, I think they called them horseless carriages. You might feel threatened by this idea. You might think it's ridiculous. There would be no roads as we know them today. There would be no gas stations. There would be no electric places to plug in cars. My understanding that I've learned just recently is I guess a lot of the early cars were steam cars. A lot of them were electric cars. Over time, the status quo was challenged. Over time, the drivers, the desires, the incentives reached a point where cities began to create roads that would accommodate cars. Companies would create gas stations that would provide the gas for cars. Repair shops popped up in cities. And so over time, we reached a tipping point. We reached a point of phase transition where horses were no longer the primary mode of transportation, but cars became the primary mode of transportation. Similarly, today, we need the vision of a better health system. We need innovators to think about and create new ways of doing things. We need industries and professions and education and research and policy and communities to co-evolve to create a better health system. We need to disrupt the status quo. We need enough people to change what they're doing and invest in a better way of doing things so that we can all settle into a society that is much better. We need to realize that the way that we relate with the industry relates with communities, and research relates with education, and practice relates with communities. Those relationships are crucial for transforming the health system. Now, many might say, well, cars have actually made the world a worse place through environmental impacts and through the disruption of communities. And I think in many ways that may be true. So anytime there is a phase transition or a tipping point or a transformation of a system, we as a society need to create boundaries and limitations and ways so that the new system benefits us all, benefits our earth, and makes the world a better place. I'd love your thoughts. Thank you.